My name is Johan Vos. I'm the Deputy Executive Director of Alzheimer's Disease International. My role is obviously to deputize for our Executive Director, but we also have specific areas where we focus on in the world. So I look after predominantly the region of the Americas and also of Africa as well, and work with the regional World Health Organization to influence the dementia agenda. And of course I deputize whenever required when our Executive Director is not there. Yeah, Alzheimer's Disease International was established about 30 years ago by 4 of our members, and really the purpose was to influence the global health agenda and also to strengthen our member associations, which have grown now from the original 4 or 5 that started it to 83 members across the world. And strength is in numbers, so the more members we have, the stronger our voice is. Our members predominantly work in their countries to help and strengthen the support infrastructure and also work with their governments to, on a national level, to put dementia on the agenda and to get their governments to take more action. And from our part, we support our members in that endeavor, but also work globally with the World Health Organization, the United Nations, the OECD, all the global health agencies that we work with closely. And for instance, with the World Health Organization, we have consultative status, so we have opportunities to be at meetings and to also provide feedback. One of our main aims for Alzheimer's Disease International is for governments to make dementia a national health priority. That is important because Alzheimer's is a disease that is growing. It's as a result of an aging population. So at the moment we have about 48 million people with dementia, and by 2050 that will increase to 131 million people. So that's a huge increase, and also the cost as well. The cost of Alzheimer's worldwide, globally, is 818 billion US dollars, and that will soon get to 1 trillion in 2018 and even 2 trillion by 2030. So you can imagine that there's huge challenges for governments to take action and do something, because if they don't, it will cripple their health systems. So one of our key advocacy platforms is to say that every country should have a national dementia plan. Now, the UK has got one such plan, and also other countries. In fact, Australia was the first country to have a national dementia plan. And now I'm pleased to say that at least 20 odd countries have such a plan. And such a plan means that those countries are better prepared for the dementia epidemic, because it will cost an enormous amount of money and it will require good care, and that's what those plans will help ensure. So that's one thing. And the other thing is we also try to strengthen our member associations as well, because stronger members means that they can be more effective in their roles within their country. And the other thing that we do is we also encourage more research, because as much as we believe that we must do our best to care for people with dementia and their carers, through a very cruel and horrible disease, we must also firmly keep our eyes on finding a cure. We believe that there's not enough money going into research for dementia, and we would really like to see that upscaled substantially to about 1% of the total global cost of dementia. So we would like to see that increase to about 8 billion US this year. The report tells us that the cost of dementia, as I mentioned before, is quite large, and I think that has woken up a lot of governments as well. We have even broken that down to country level, so where required we can give this information by country, and have done so. Because as much as we like to work with governments around the world and help them come with solutions, part of that solution is also stating the fact as the situation is currently. So that's why this report from King's College in London is extremely valuable. It's also valuable because of the prevalence of dementia. So prevalence is increasing, and roughly it's doubling every 20 years. But in some regions of the world, like for instance in Africa, the prevalence is quadrupling. So that's a result of an aging population and basically people living longer and healthier. It's a result of improvements in health systems, and the consequence, good consequence, people living longer, but people living longer are also have a higher chance of developing dementia. So, so it's important to know that we need to address these issues. What is also comes out of the report is that most of dementia will occur in the lower and middle income countries. So roughly 2/3 of that will be in these countries. Although the cost of dementia, as I alluded to earlier, that happens in most of the high-income countries. But at Alzheimer's Disease International, we believe that finding solutions for high-income countries, but particularly for lower and middle-income countries, need to be practical and cost-effective as well. The other thing that came out of the report, that we also need to pay attention to risk reduction strategies, make people aware of some of the risk factors around dementia, and they include smoking, hypertension, diabetes, and so forth. So it's really important that governments also invest in a public education program and make people aware of the risks of dementia and how they can try to mitigate against that. Well, what we hope is that it helps us having a conversation. So it helps us having a conversation around the World Health Organization and the UN, so they take stronger action and come up with resolutions that will mandate governments or member states around the world to do something about it. And at the national level, through the work with our member associations, it will help them to have those conversations at the national level with their governments as well, and to articulate the case for support to do more for people affected by dementia in these countries. And some of the countries that we work with, like for instance countries in Africa, dementia is not even on the radar, but the stigma is very big in those countries. For instance, in countries like Ghana in Africa, people are treated in the most horrible ways. There are witch camps in Ghana where obviously women who family members believe that they are acting strange, and they banish them from their family and even take them to those camps where they are treated in the most inhumane way. So we also believe that dementia is a rights issue as well, that people with dementia deserve around the world to be treated with respect, with dignity, and that is what we're working on as well, to make it a rights issue globally. I think, I mean, there is the risk with the numbers and the way the disease is going that it will cripple healthcare systems, and that certainly has the potential if governments don't take action, hence why we advocate for governments to develop a national dementia plan. So a national dementia plan would incorporate things like a public awareness program, supporting the carers, because it's the family carers that actually carry the burden of the disease, because it's a long-term condition, could take over 10 years, and and they carry the burden of this disease by looking after them for such a long time. So the provision of good care or good support is hugely important, and governments need to invest in that, because there is some good evidence that would suggest that working on early intervention, early diagnosis, and closing the treatment gap is hugely important. From our previous reports, we know that in high-income countries, such as here in the UK, half the people have received a diagnosis and half not. But in lower middle income countries, only 10% of people have received a diagnosis. And not having a diagnosis makes it very difficult for families to cope with this disease, because they don't know how the disease manifests itself, they don't know how to provide good care. And indeed, there is even medicine available that is beneficial during the early stages that could slow the disease down a little bit. So not having a diagnosis means that those options are not available. So we really encourage governments to invest in that and believe that is also a cost-effective way to help people. Well, I think that research is something that ultimately we want to find a cure. That's hugely important. But research is also for how to best care for people that have the disease now, and I think that's also hugely important. We need to support people now, but we need to support people tomorrow. Tomorrow is the cure, today is looking after people in the best way possible. And there have been quite a big shift in how we care for people with dementia over the past 10, 20 years. 20, 30 years ago, people were too afraid to even come out with their family member who has dementia, because they were ashamed, they didn't want to be seen with their loved one who has dementia. But now a new initiative that originally came from Japan, called Dementia-Friendly Communities, aims to address that and make more people aware, the general public, what dementia is, and that it's not a normal part of aging, it's actually a disease, and people need to embrace people with dementia and look at the person who they are and not look at the limitations. So the dementia-friendly community concept is something that here in the UK is promoted by the Alzheimer's Society, who are one of our 83 members. Originally it came from Japan, so our organization in Japan is also heavily involved in that. And I think it's a really nice way for a community to embrace people with dementia, to make sure that they know about the disease and also know how to support a person who they think may have dementia. That particular study, we've got a slightly more conservative view on that. We think that it's way too, there's not enough evidence for that to make those statements. Of course, we would like to see more research, so we always welcome more research in that area as well. But our report firmly, which is a very comprehensive, systematic review of all the evidence across the world of any prevalence study that has been done, and it's been looked at in terms of its weighting, its accuracy and so forth, and then all put together, our report would suggest that it's still increasing, it's still roughly doubling, and that we haven't seen any really big conclusive evidence that that it is declining or even flattening out, as some reporters have suggested. So, because ultimately, you know, the dementia is an age-related disease. There's a huge increase in the number of people aging in the world. So obviously that will drive the prevalence. Well, World Alzheimer's Month is primarily an awareness-raising program. So we've created an amazing website where all kind of resources are available for people to download. So anyone in the world can get involved during the month of September with activities in their community. Of course, our Alzheimer's societies right across the world are heavily involved in these activities as well. And yes, it's about doing memory walks on the streets. It's about free clinics. It's about just doing public awareness programs to really focus attention on dementia, to destigmatize the disease as well, make people aware of dementia, also make policy makers aware of dementia as well in those countries, and really try to get dementia on the radar. But also encourage people to learn more about dementia, to maybe become involved in dementia-friendly communities. So it's a whole raft of activities. But our website and all the other information is readily available for people to participate. But yeah, it's a program that has been going for many years now, and it's getting stronger and stronger, and that's really encouraging.